Diana Kerwin. I specialize in Alzheimer's disease and brain health, and I'm the founder and president of Kerwin Medical Center. I started Kerwin Medical Center in 2018 after many years in Alzheimer's care and research. I wanted to establish a center in North Texas, really to serve the community, to serve as a resource for anyone who's looking for information about brain health, prevention of dementia, prevention of cognitive disorders, or someone who has a diagnosis or is worried about their memory. The center is really here for you to come in and get more information about your brain health and your health information. My staff is experienced and trained in evaluating memory disorders. They can also provide information about what research is available both at our center as well as in centers across the North Texas area.
Hi, Jennifer here with Kerwin Medical Center. So what should you expect at your initial pre-screen evaluation? Well, the visit is quite simple. It will take anywhere between 45 minutes to an hour, and you would be welcomed by our staff. We would provide you with what's called a pre-screen informed consent. Now, we would give you plenty of time to review over the document, and essentially, if you're okay with providing additional information about you, then we would go ahead and have you sign the document, and we would proceed on with getting a little bit more information about you. There is what's called a pre-screen packet that is located on our website. You can access that document at any time. Just give our office a call. It is password protected. We do ask that you go ahead and fill out the form as much as possible. What you'll see are questions about, do you have memory loss? If so, when did it start? Do you have a diagnosis of any kind of memory disorder? Do you have a family history of dementia or memory disorders? Are you taking any medications for your memory loss? Or are you taking any medications for any other medical conditions? Those information is quite helpful. Also, having the information for your doctor's office is very helpful for us as well. We also want to know, do you have a device such as a pacemaker or a defibrillator? If you do, having that information with the card available would help us out tremendously. And so at the visit, there would be a brief memory evaluation that's done. This will give us a baseline understanding of where your memory is at. And then at the completion of the visit, we would actually reach out to your doctor's office, collect your medical records, and then as a team, we would review over everything together and then reach back out to you to share about any currently enrolling trials that you might be eligible for. So location-wise, we are located here conveniently within the Texas Health Presbyterian Dallas campus, right here off of 75 in Walnut Hill. Parking is quite easily and accessible just right outside our doors. Parking is in parking lot 11, and as you walk through the double doors of the Jackson building, you would take a left, walk down the hall. Our office suite is in office 100, right there on the left-hand side, just past the chapel. So we are always here to help answer any of your questions. Please don't ever hesitate to reach out to give us a call. We are here for you.
Hopefully you're coming in because you want to learn more about your medical health, and that's really what we're here for. I'd like to be able to provide you and your doctor more information about what your risk factors may be, if there is a prevention study that you might be a part of, or if you do have a diagnosis or we detect that there could be an early onset or early signs of something happening to your memory, we would want to be able to talk to you about what clinical research is available to you and what might be appropriate. Our center has usually multiple studies going on at any time, with new studies starting all the time. The science in this area and the therapeutic developments are moving fast. So we're also a resource to give you the information about the most up-to-date data that's available about what is happening in Alzheimer's disease, what's happening with new therapies that are being approved or developed. We will work with your physician, being sure that they're aware if you are a part of one of our clinical trials. We'll keep you updated on what's happening with the studies. And then also we work collaboratively with centers around the North Texas area. If there's a study that you're working with in another center, doctor, we can work with them as well to be sure that they get all the information that they need. The one thing about Kerwin Medical Center is it was established to be a resource to our community. So please, we're here at any time. Feel free to call our office. You can also submit a contact information on the website. We oftentimes have Facebook pages open that's announcing new studies or new developments in Alzheimer's and other areas. But again, we're always here to answer questions, so please feel free to contact us.